If you keep waking up at night with numb, tingling hands, especially in your thumb, index, and middle fingers, and shaking your hand makes it feel better, this video is for you. That pattern is a classic sign of carpal tunnel syndrome, a pinched nerve at the wrist. The good news is that it's common, and when it's caught early, simple steps often help. Over the next few minutes, I'll walk you through why it happens, why it tends to be worse at night, a quick self-check you can do at home, how it differs from lookalikes such as a pinched neck nerve, what actually helps, and the warning signs that mean you should see a doctor. So what's actually happening inside your wrist? On the palm side there's a narrow passage made of small wrist bones and a tough band of tissue called the transverse carpal ligament. That passage is the carpal tunnel, and running through it is the median nerve. Carpal tunnel syndrome happens when that nerve gets squeezed as it passes through. Pressure rises when the tunnel narrows or the tissue around the tendon swells, and the fingers it serves start to feel numb, tingly, or painful. Here's a clue worth remembering. The median nerve supplies the thumb, index, middle, and the thumb side half of the ring finger, and it usually spares the little finger. And why? Let's talk about who tends to get this and a quick self-check. Certain things raise the odds, like repetitive wrist use, pregnancy, diabetes, an underactive thyroid, rheumatoid arthritis, and being female or over 40. Having a risk factor doesn't mean you'll definitely develop it, it just raises the background odds. Now, for orientation only, not a diagnosis, see how many of these fit you. Numbness wakes you at night or early morning. Shaking or flicking your hand briefly relieves it. The numbness sits in your thumb, index, middle, and thumb side ring finger, with the little finger relatively spared, and your symptoms came on gradually and come and go. You can also loosely try. Here's where it gets tricky, because several different problems can make your hand feel numb, and they're easy to mix up. The most common look-alike is a pinched nerve in your neck, called cervical radiculopathy. That one tends to come with neck or shoulder pain and reduced neck movement, and the numbness is usually less night dominant. Carpal tunnel, by contrast, spares the pinky, is worse at night, and eases when you shake your hand. If your numbness is mainly in the little finger and pinky side ring finger, that points instead toward an ulnar nerve problem, since carpal tunnel spares the pinky. And if you have symmetric numbness in both hands and both feet, often with a diabetes history, that suggests. So what actually helps? If your symptoms are mild and early, it's reasonable to start with self-care, though results vary from person to person. The most useful step is a wrist splint that holds your wrist straight, worn especially at night, so it can't bend while you sleep. Be patient, because it may take up to 6 weeks to help. Cut back on repeated wrist bending and forceful gripping. Take regular breaks to shake out your hands, and set up your keyboard and mouse so your wrists aren't bent upward. Gentle wrist stretches within a pain-free range are fine to try, though the evidence for them is limited. If self-care isn't enough, care steps up to a court. Before we finish, here are the red flags that mean stop self-managing and get seen promptly. Thinning or flattening of the muscle at the base of your thumb. Constant numbness that no longer comes and goes. Weakness, frequently dropping things, or trouble with fine tasks like buttoning a shirt. Sudden numbness or pain after a wrist injury. Neck or shoulder pain alongside the numbness, or numbness in both hands or spreading to your feet. Those aren't a wait and see stage. They're a get it checked now stage. So to recap, carpal tunnel is the median nerve squeezed at your wrist, with the classic pattern of numb hands at night that ease when you shake them while the pinky is spared. Early on,